The Federation of Animal Science Societies has produced this tape as part of a series of education tools. Farm animal scientists, workers, and students should review the introductory materials before starting this species-specific equine program. The introductory materials highlight the importance of the Institutional Animal Care and Use Committee, or IACUC, and the overall animal care program. The animal care program is organized into sections, including administrative oversight, occupational health and safety, the physical plant, and species-specific animal care. This training module is intended to provide an overview of equine and a more in-depth examination of the care and management of horses.
Horses are maintained in a variety of facilities, individual stalls, outside pastures, or a combination of each. Stalls are typically 10 feet by 10 feet, but may be 12 feet by 12 feet for a mature horse. Solid partitions are normally used to separate horses between stalls.
Horses produce an average of 45 pounds of manure daily. That's over 7 tons a year. Stalls should be cleaned daily and should be well bedded. Wet, dirty bedding can lead to thrush, which is a hoof infection that may cause lameness. Horses must have a dry area for lying down.
Many different types of fencing are appropriate for horses. Some include wooden posts and rails, V-mesh wire, electric fences, or plastic, pipe, or chain link fencing. Avoid barbed wire fences with steel posts. The height of the fence should be 4.5 to 6 feet tall, and the bottom of the fence should be 10 inches above the ground.
Gates should be wide enough to allow safe passage for both the handler and the horse. Gates that are not well maintained can injure both the horse and the handler. Gates should be high enough that horses don't attempt to jump over them. Latches should be secure. A curious horse can open gates without secure latches.
Horses should be fed hay and grain from a feeder. When feeders are located at ground level, the horse's nasal passages may drain properly. Feeders should be designed to appropriately contain the hay while minimizing contamination. Various types of feeders are acceptable as long as these are safe. The spacing of the feeders is also important. The location of feeders should allow enough room between aggressive horses. This will minimize fighting between herd mates. As a common practice, allow one more feeding space than there are horses. This way, both aggressive and timid horses may eat simultaneously. Horses kept in stalls are usually fed 2 to 3 times a day. Leftover feed should be removed prior to the next feeding.
Horses should have easy access to water at all times, except after some types of strenuous exercise. Water should be free of debris and large accumulations of algae. Even under severe weather conditions, water should be available to horses several times daily. Horses require different degrees of handling based on their training, past experiences, and instincts. All horses have a strong group or herd instinct. In their wild or feral state, horses found safety in numbers. Today, the domestic horse has developed many behaviors and responses directly from those strong survival instincts in the wild.
Horses living in a herd have a ranking system or pecking order. A boss horse at the top of the order can be a mare, gelding, or stallion. The weakest horse, usually a young horse, is on the bottom of the order. Once this pecking order is established, little fighting occurs among herd mates. When a new horse is introduced to the herd, he will have to test all of the horses to find out where he stands. Pecking order is often noticeable during feeding in groups because the boss horse eats first.
The first line of defense for a horse is to use his natural speed to run from danger. Frightening situations may evoke this reaction. If a frightened or threatened horse is cornered, he may fight by biting, kicking, or striking. However, horses can be trained to obey handlers even when their instincts tell them to run. Leaving the herd may be stressful for untrained horses, and isolation from other horses may be extremely difficult. Some horses have difficulty remaining calm under these circumstances.
The eyesight of a horse is very much related to the need to detect predators on the horizon and recognizing danger. Horses don't have accurate vision up close, but can see the smallest movements at a distance. It is important to remember that there is a blind spot directly behind the horse, and he cannot see below his nose. Handlers must respect any unexpected movements in these areas, which may be startling to the untrained horse. Horses change their head and neck position to focus on objects. Raising his head allows the horse to focus on objects in the distance. Lowering his head lets him examine objects close up.
Horses use their sense of touch to examine strange objects with their muzzle and lips. They have a very sensitive touch. For example, a horse can feel a fly land on his skin. Many training aids are based on touch, like halters, bridles, and bits. The handling of a horse depends on his level of sensitivity and his training.
Horses have very acute hearing because they are able to swivel their ears in the direction of a sound. They can hear very soft sounds, which may indicate a stalking predator. Trained horses can even differentiate the tone of a handler's voice.
A healthy horse is alert, bright-eyed, and has a glossy coat. Although some horses are finicky eaters, most healthy horses have a good appetite at feeding time. The normal rectal temperature of a horse is between 99 and 101 degrees Fahrenheit. His pulse rate is 30 to 40 beats per minute at rest, and his respiration rate is normally 8 to 16 breaths per minute.
Signs of distress and pain in horses vary. These may be noticeable in posture, vocalization, or facial expression. More intense physiological responses include diarrhea, sweating, and increased respiration. When in distress, a horse usually shows a lack of appetite or a depressed attitude. He may be unwilling to move. A discharge from the eyes or nose and coughing can all indicate illness. A horse in pain, such as that caused by colic, may swivel his ears back repeatedly toward his abdomen, may kick his belly, or may even roll. Horses in pain usually have tense muscles, an increased pulse and respiration rate, and may sweat, especially in the shoulder and neck area. If a horse is injured, he may try to guard the area to minimize the pain. This may be observed in altered posture or a lame gait.
Approach a horse near his shoulder, preferably the left shoulder. Avoid his blind area, which is directly behind him. Touch his shoulder with your hand. Firmly stroke his neck and shoulder area. Speak in a soothing, calm, and confident voice. Usually the horse will acknowledge you by turning his head in your direction.
Haltering is a basic handling skill. Slip the lead rope of the halter over the horse's neck. If he starts to move away, you have some control. Hold the halter by each side and gently scoop his head into the opened halter. Place the crown piece over his head and fasten the buckle. You should be on the left side of the horse to lead him. Place your right hand about 6 inches from the halter on the lead rope and hold the excess lead rope in your left hand. Do not loop the lead rope around your hand. This can be dangerous if the horse jumps and pulls the rope tight around your hand. The length of the rope should allow some movement of the head and neck, but should not be so long that it gets tangled in the horse's legs.
Always tie a trained horse with a thick lead rope and not a leather lead shank. Use a quick release knot. Never tie the lead rope to objects that are not strong enough to hold a struggling horse. Cross tying is commonly used for quiet horses during grooming or shoeing processes. Quick release snaps are attached to each side of the halter. This allows the handler to safely release the horse if he pulls back or fights the cross ties.
Sometimes horses must be restrained for short periods of time to complete certain procedures such as injections, and these may cause some discomfort. A chain of a lead shank applied over the nose can be used to minimize any forward movements, and a twitch applied to the nose can keep a horse quietly standing for procedures that may be painful.
A handler may also hold up one of the horse's legs to restrain him. This limits the movement of the other legs because they are bearing the weight of the horse. This technique is helpful when examining or bandaging an injured leg. All types of restraint should be used calmly and gently and only for the minimum time necessary.
A horse may be anxious when returning to a pasture containing its herd mates or to its stall. Care should be taken when going through a gate or stall door to avoid bumping the horse. Latching the gate will help to keep the horse from escaping. Turning the horse to face the gate or stall door before removing the halter will set the stage for a safe exit by the handler. Removal of the halter should be performed quietly. The horse should not bolt back to his herd mates, but should be encouraged to quietly stand or amble off.
Distressed, anxious, or nervous horses may display vices or stereotypes in stalls, such as cribbing, weaving, or stall walking. Environmental enrichment, such as hanging balls or tires placed on the stall floor, may help to discourage these vices. Exercise, interaction with other compatible horses, and daily turnout may also assist in managing these vices.
You will learn many aspects of the care and handling of horses when working alongside more experienced caretakers. Some situations are more easily handled when several people are assisting. Designing and maintaining facilities is important to prevent injuries to both horses and handlers, and will assist with the ease of handling. Knowledge of basic equine behavior is essential in assessing difficult handling situations, especially in new environments or for procedures that involve a degree of discomfort.
This concludes the video portion of Equine Training Level 1 from FASS. Please view the PowerPoint presentation that accompanies Level 1 training next.